You've taken a holistic view. WHO really is. I love United Nations, so that is United Nations. And also, second, you show a goal, a view forward. You show something we want to accomplish, where we're heading to. But then you start to show figures. Then I got terrible. It feels not good. Can't you make any better figures or something like that?
I think that's not our job.
That's not your job. Okay. Okay, so we have to live with that. Okay, so now we have a view, and now we have the last session of this conference. The session that everyone has longed for and looking forward to listen now. Because now the challenge is for us and the panel here is to say something that you haven't heard before. To say something that is new to you. Say something that you think that, yes, this made me understood the whole conference better. So the pressure is totally on your five guys in the panel. So we have we have a written statement here, which I think is quite good, so I will read it. This conference has attempted to find common ground in developing the tools and the systems needed in Europe to put patient at the center of an efficient, digitally driven and responsive new healthcare system that focused on prevention while also promoting healthy lifestyles decision. Isn't that great? So, I have one question for you all here, and I would like your view on that and how you think of that. I don't know if you prepared any speeches, so forget about them. What I would like to hear from you, from your various perspectives, is how and what would you do and how would you commit to make this happen? We have first in the list in my paper is Richard. He's writing on his answer here.
Yes.
So,
you always improvise, so you never know.
How are you going to commit on this? You're a Swede, you can improvise.
Yes.
Seconds are ticking.
Yeah. So I listened to a presentation recently by Bert Löfkens, who is in the Netherlands, and he's chair of the drug approval committee of the MEB in the Netherlands. And he had a slide which I don't have, and I won't show it, but he talked about the three challenges we have as all of us, as society, in meeting the health needs of the population. One is that there are areas where we have great medicines and devices and knowledge, and we are just not delivering it. Okay? So we have a lack of health in the population and people suffering. We do have the tools, but we're not using them correctly. Okay? So that's one challenge. The next challenge is when the science is there, but the products have not been developed or the solutions have not been developed. And that's what we do all the time, I think, as an industry. Okay? And I think that kind of works. I think that innovation model is working now. Whether people get the innovation is another question. We have increasing inequalities in Europe. People wait many, many years to get access to it. But it's somehow in hand. Okay? We know what to do, and we can come back to this later.
This is a lot what you don't do.
Well, I want to come to the next to one area what we don't do, and that's where we don't understand the science. We don't understand the disease. Okay? So you have all these three problems, where you have the drugs and you have the medicines, you have the tools you're not delivering. And then the other one where we don't know is where we don't understand the science yet. We don't understand Alzheimer. We don't understand many of the mental diseases. Okay, I mean, it was tweeted yesterday, the fact that we hadn't really referred too much to this. Same thing with asthma, COPD. There are a number of diseases where we treat signs and symptoms, but we don't really know the underlying causes. We were chatting over lunch, you and I, about the fact that if you give immunomodulating agents or agents that sort of change the immune system, of course it will have an impact on patients' lives because they can't take vaccines and they get infections. So in both these two buckets of optimizing use of existing technology and addressing the science of disease, we are working a lot and we are committed to new solutions. So in the first bucket, which is very much what was discussed this morning, is to equip the health system and patients themselves with the tools to actually utilize the innovation we already have. And many of these things are already off patent, so they're quite affordable on top of that in the system. So you take stroke, hypertension, high cholesterol. you know, we have, largely speaking, for most patients, we have the medicines, and they don't cost anything, and still, you know, we have, I don't know how many, I don't know the latest statistics, probably more than 100,000 or even more millions of people in Europe that have stroke every year, you know, and it's largely avoidable, largely avoidable. It's lifestyle, but it's also about using some of these standard medicines, particularly secondary prophylaxis or prevention, as you talked about yesterday, Andrzej. So what we can do now with the advent of the wearables and the sensors and the apps, and everyone's carrying around a supercomputer called a smartphone, surely we must be able to equip patients with much better tools. So I'm quite excited about the fact that, and I must give the Commission, again, DG Connect, credit for addressing this in the right way, the right questions, you know, and not too much of heavy regulation, but work with the industry. And it's going to be the big thing for my industry the next few years, is how we're going to partner and liaise with the ICT industry, and how we're going to build in patient input so that what we come with is actually relevant for patients. So this is the next frontier, really. That's one of the two frontiers I'm talking about. Is this? It's going to be a lot about technology, yes, but you know, it will allow us to deploy old innovation or current innovation much better. So that's an area where we are committed as an industry. The second challenge was this, where we don't understand the disease. And that's the reason why we have all these partnerships now, where companies go together and pool all their knowledge. You can refer to as open innovation, whatever you want, networked innovation. Companies are in an unprecedented way sharing information with one another. And IMI is the world's largest public-private partnership in life science, and it's going very well. And my hope and belief is that we're going to run out of money. Andrzej, we're both on the board. Hopefully, if it goes well, you know, we will find out that we need to top it up because there's so many projects. One example is Alzheimer, where we keep failing, you know, because we don't understand the disease. So not only do we pool the data now, we're going to do joint clinical trials. This is where, you know, we spend a lot of money on running individual trials. The companies will go together. We have 5 companies now which said that next phase 2B, phase 3 trials we will do together to learn from one another, one placebo arm, as you're all familiar with the field, so I can be technical. So this is big time happening, and we're committed in a whole different way to make sure that we don't have time to sit and wait. You know, we need to just accelerate drug development big time. So we're very committed as an industry to do that. So I would mention those two things as the biggest challenges and commitments from the side of the industry.
Then I have 2 questions. You say you want to equip the patient with the things you have, because you have a lot of in your shelf and the storehouse, whatever it is. What happens if the patient doesn't want it, doesn't want to have it? Will you do it in a dialogue, or will you just ship it out?
Well, first of all, it's not us doing it. It's physicians, of course, with patients. It could, to an extent, be pharmacists and nurses. But my point is this: is that we have all these great medicines, and they're not being used properly. We have ample evidence that, you know, we're failing big time on coordination of care and of treating chronic disease. You know, we're simply not getting. We have all these great medicines, and either not taken. And it's not just about compliance,
so
adherence.
You mean this is beyond
motivation.
The patient's view?
Yeah, it's about it has to start with a motivated patient, okay? And it's not about compliance and forcing people, telling people to do something. You know, they have to be encouraged and motivated. I've been very encouraged by, I'm giving a lot of praise to DG Connect today, but the Director General Robert Madlin, he always talks about that we need to gamify things, we need to make it interesting for patients and citizens to play along. You know, we need to learn from the consumer industry that how do you get people get hooked on Candy Crush or things like that. Now I don't see many people playing it anymore. I was hooked for a while until I got to level 84 or something. But you know, people can be seduced in a way to do certain things, you know. So why can't we do that on health? I think there's huge potential if all these geeks, many of them in Sweden, by the way, or Finland, you know, all these IT people, you know, they need to stay in Europe, by the way, to do this. They shouldn't have to emigrate to the US to be entrepreneurs. But how can we unleash all this creativity in the space of health and nudge patients and citizens that are not been diagnosed yet even to worry about, you know, thinking about their well-being?
You don't need the geeks. You can just ask us, and we will tell you what about it and how to do it.
Geek to me is a positive word. It's
I know, for me too.
Flattery.
I think about the other thing you said, you want to make a decision better, understand better. Will we see companies work together in a common disease and make, what do you call it, this, work their own different researchers to grow together?
Well, that's what's happening now, increasingly, is that the companies are pooling their knowledge,
yeah,
and learning. The next step is going to be what we've announced it today, and Elisabeth Kuiper talked about it, is this IMI program, looking at actually bringing it all the way to the patient. So it's not just about coming up with some innovation which is not going to be used, but to think about the last mile. The last mile. There's a lot of discussion in the community of health technology assessment and payers about involving health systems. So I think we all know that we need to involve patients throughout the life cycle. But also the health systems. These are the people that will actually take the innovation the last mile to the patient. And they are not really involved in many of these discussions. So that's the next area. And the question is, to what extent can our companies that are competitors, to what extent can they collaborate on that last mile? Could we have, for, let's say, the new MS drugs we have new psoriasis medicines coming, where there's going to be very good competition, it's going to be good price competition, which is good for the payers. But could we find a collaborative space of actually implementing these in a controlled way and track outcomes and all that? And this is where we're finding our way now with our companies. With Hep C, we were too late to figure this out, and it's a bit of a special, hepatitis C is a bit special case because it's a one-off cure situation. But if you talk about new cholesterol-lowering drugs, asthma, COPD, fantastic things in the pipeline, could we somehow work collectively in making sure that everyone in Europe would get these medicines?
So the answer is yes.
Yes, absolutely. Collaboration is the theme of the decade.
Easy to say, yes. Thank you. Okay, I'm jumping here. I asked Andrzej to speak next, but you have to wait now because I think a European Public Health Alliance. Peter, what is your first commitment and reaction and the feeling in this? But what are you and your organization committed to do in order to deliver the Riga roadmap?
Well, I'm a board member of the European Public Health Alliance, but I'm as well a community activist for the European AIDS treatment group. So whatever I tell has a lot to do with the community and with the needs of the community. What I sort of, and I talk about what's necessary for us is to speak in a clear language. And if you remember yesterday, I asked here at the floor, please be clear what, and I missed that. For example, I didn't hear the word harm reduction services for drug users. We have a major problem among the drug users in Germany. They are the drivers they have hepatitis C, lots of them, they have HIV, and this is not addressed. They are more or less completely excluded from the discourse. And then we have, of course, you talked about Candy Crush, and I just noted it down because I thought I should jump on that, you know. If you want to sort of encourage drug users to be, you know, to sort of be enlightened with health, just give them the drugs and make them available, and not I mean, hepatitis C drugs. We in Germany, I come from very, very rich countries, and I do trainings a lot. I experience every week, because we do trainings on treatment literacy, and we have to tell them, well, we told you the last 3 years there are new drugs coming up, they are in the pipeline, they look quite promising, and now we have to tell them, I'm sorry, we are sorry, you won't get them the next 5, 6, or 10 years because they're simply too expensive. Just imagine we have 500,000 people living with hepatitis C in Germany. There are prisons where about 30% of all prisoners have hepatitis C because there are so many drug users in prison because of our laws. And the budget in prison is so limited. So what are you doing? And you can't do anything. They won't get the medicines, so just make them as cheap as candies. And they are that cheap. And you know that. You know that this price of 100,000 for one treatment course is completely not justifiable, and this needs to be changed. So I would like to have a discussion here on how to change that and to sort of discuss it seriously. This is completely unethical to me as a community person. And when I get back to my country, I really don't know what to say because I didn't see any solutions. So how and why do we allow that the prices are that high? Why don't we regulate that? Why don't we support Medicine du Monde, for example, when they try to challenge the patent system? We should do that. Why is Europe not doing that? Why do we allow that these price negotiations are taking not place in public? I listened in Germany, my country, again, that some insurances, health insurances, they have secret discussions with the industry. And nobody knows how much they pay at the end of the day. This is completely nonsense to me as somebody who works with this vulnerable populations, and this needs to be changed.
Why do you think they don't change?
Because if you have a discussion in secret, then
yeah, that's the guy.
You get a better deal.
You get a better deal, exactly.
Well, isn't that good? I think they have this debate about price transparency. I think we're learning now. We have to figure out what's the right level of transparency. I think that the reality is that the net prices for hepatitis E are far lower than what the press reports. Okay, which is a good thing. All our companies are now negotiating right and left. Okay, so this is good news for Europe's patients. Okay.
I'm sorry, but the reality is that the people I talk to in prison, they don't have access to medicines, and they have to wait 10 years more, and nobody knows if they will survive or not.
So one of the things you want to be committed to is to make an awareness about the patients in prisons in Europe, not in Germany, but in Europe totally as well.
For example, I mean, this
and also the other one you said about clear language.
Yes. I mean, I addressed prison realities yesterday because I didn't hear the word a single time. And prisoners are structurally excluded. If we talk about health in all policies, then we have to talk about prison realities. How come that the prison health is under the authority of the Ministry of Justice and not the Ministries of Health? Why do we accept that? If prison health is public health, we have to integrate them, we have to invite them. Why is there no health, no just Minister of Justice here in a room? Why is nobody invited? Why do we allow that? They have double standards. They have a limited budget. They are not integrated in the overall public health system. And whatever not happens in prison will go back to society because there's a huge turnover of prisoners in Europe. We talk about hundreds of thousands of people.
Okay.
They don't get vaccination. They don't get treatment or limited treatment. They get out of diseases. They won't get condoms. I work in the Bavarian prisons. And we did a research a couple of years ago, and we discovered in 1 year, for 9,600 prisoners, 36 condoms were distributed the whole year. This is a scandal.
Okay. Okay. Yeah, there's several levels and layers in what you're talking about in prison and how to make that. But as you say, that is part of the society. So if we're going to find a solution for society, all sources, all part of society has to be on the plate and on the table. So I think it's very good you put that. And a clear language, I totally endorse that. That is extremely important so that everyone understood. I think one of the questions earlier we had all about the question we were responding to. The language there was so difficult in a way to understand. So that's why I think some people push 1 and 2 there. At least that is my excuse.
Can I ask Peter a question, follow-up question? Because France had a very sort of aggressive... Can I?
Yes, you may, to make it short.
No, there's on the prisons again, okay? I think this is very interesting. I learn every day. Now, in France, did the prisoners get the Hep C drugs?
I don't live in France, I can't say. Okay. I know the situation in Germany, so I don't have an overall view. I'm a freelancer, I do this, this as a volunteer. But I would be surprised if every prisoner would get treatment because the country would explode.
Okay. Well, they've spent already 2 billion euros on Hep C drugs.
Okay, but the fact is that the budgets for prison health are very limited compared to budgets compared to the budgets you would have outside of prison.
Okay.
So that's the problem.
We have the privilege to leave the prison now, so we move on to this. Some people, Andrzej, some people think that Europe is run by European Commission. Some people even think that European Parliament is a strong player. You live in the European Commission, so when we say that we want to find a common ground in developing the tools and systems needed in Europe to put patient at the center of an efficient, digital-driven and responsive, blah, 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 it must be very easy for you to fix it. So how are you going to do that? Because you have all the tools and our money.
No, I think what I like to add to this debate it's a long journey, you know. I really remember our first meeting.
That was in a nightclub in Krakow.
No, be correct. It was not nightclub. It was a famous cabaret and famous singer. You know, be correct. You know, so.
2 floors below.
Yeah, it's true. The situation, you know, in this moment is that we would like to be all on the same page. I think that this is the good news, you know, coming out of this meeting, at least for me. I miss one group in this room during debate, the health professionals. We had students speaking, medical students, and we had a chance also to chat last night about their future as a health professionals and the choices they are making, looking for different options, professional options. And I think they also represent, you know, in one hand, the future health professionals. They will practice medicine and be in the health systems next dozens of years, but also represent new generation of people, researchers and patients as well. And of course, you know, my first kind of challenge we in this debate is, you know, are we ready for the challenge coming with a new generation of you geeks or people using, you know, different way of communicating, different way of be educated, different way of connected with patients. So I think this is the first challenge, at least, you know, I would like to understand better and be prepared. Today we discussed about values. Can we predict values in the future? I am sure the values as be a good doctor, good nurse is a value which is, you know, carried through the centuries. And really, I wish that the health professionals be more committed to this exercise we are shaping here during these 2 days. And we as a commission, we are committed to this. We are working, you know, closely with a number of stakeholders and trying to kind of develop new stage of the development in this field. So this is how I see our role. The second role, of course, is the one which Richard explained already, the kind of future of industry. I mean, we call this more and more like a life science industry. I mean, the borders between, you know, pharma, medical devices, advanced therapies, tissues and cells, development, even, you know, in the area of transplantation, we see more and more, you know, companies coming together. We see also less and less difference between the industry, big industry, small industry, universities, and finally healthcare providers. You know, because this line of command is becoming, you know, closer and closer. So I think this is the next challenge. Can we really see this as a future? I don't know if we will still call this industry, because I think it's maybe even not the right word to call this new system industry, because it's a kind of community of developing innovations and the future solution for the society as such, and also in the benefit of all in the chain. It was interesting today. We had a very tricky moment when we started to vote for the outcome, and I think Mark, who was moderating this panel, asked why we put healthcare providers with patients together when we discuss outcome. And I was thinking, you know, I don't know who was the author of this question, but it's a tricky question. Is a doctor who is working, I'm a radiologist by my training, and you know, so much depends on the skills of the doctor to put the wire to your body and find the right moment of injection of molecule. that there is a involvement of healthcare providers to this system is more and more important, because you have device which is produced by the medical devices industry, but the molecule is produced more, for all kinds of pharma industry. So
new group of occupations.
So we are now more and more interconnected because of these skills we need for finally. And the last point on the communication and trust. I think that we have two problems in the same kind of area. One, I think I start from trust. I mean, the trust in the system is something we have to gain together, starting from the way industry is seen, the way we do the debate about the results of clinical trials. Just refer to the kind of debate we have in EMA about the open and transparent policy for the clinical trials results, or when we basically discuss what doctor is doing to your patient. Do you trust your doctor? Where is the trust? I really feel that this operation is more and more difficult in every level. And on communication, we discussed the health literacy, but also we discussed the problem with the digital technology. I mean, we would like us to use more digital technology, but the barriers are everywhere. And just as an anecdote to this, and I will finish. Recently, we have the meeting with the consultant. It's called Danish designer. It's not about the furniture; it's about the society and the relations. And he explained that. Danish tax office was surprised that the young generation of taxpayers was not able to fill the electronic questionnaire. And of course, they asked, how is possible? How is possible that somebody who is coming from the geeks generation is not able to fill the electronic formula? And they found an answer. The answer was that they never did this on paper. So nobody told them how to do it, and so they came to the tax office with the paper version. Please help me. And I think this is something we may lose in this debate, because we believe up there are people they understand, but they don't understand because they were not told earlier how to fill the questionnaire. So I leave this for the debate, because I think trust and communication the important piece. I think Commission can also be involved in this debate.
So sitting here with a lot of paper proves that I'm not young.
No, but you still have your chance.
I'm thinking of, we heard it from your commissioner yesterday, and we also heard it from others. And I was thinking, when you're talking about the young generation, if they step up and say, okay, we want to talk with you, but we want more commissioners to work together. We don't want only Andrzej to be here. We want a commissioner for, I don't know, is there a commission for justice and commission for finance and commission for education? For all the big five we talked about sometimes: healthcare, social care, insurance, labor market, and education, school. Is that a picture of, we can see now is Riga roadmap, next year is Luxembourg, and the year after is at that roadmap, then we will have 3 commissioners in the follow-up conference. Would that be likely, do you think?
No, I think in one hand you have division of work in the commission, but in the other hand, as President Juncker said, his commission is working not in silos. So we are encouraged to work together. So I had very regular meetings with colleagues from different departments, commission departments. Just today morning I discussed with colleagues.
So the next question is, we also can have this meeting.
So I think that there's also for stakeholders to show different health our departments, the commission, that you have also interest in their work, because we do have as DG Santé, but I think it's also intriguing, how you can show. I mean, the best example would be DG Research. I mean, we and DG Grow, we are sitting together on the board of IMI, and last Friday we spent, good 8 hours debating, how to do our job better. So I think it's an example when we can work. I think Richard can confirm. Okay. We were all active there. And
if I may make some promotion for another event in Gastein, European Health Forum Gastein, late in September or October. The organizers, I understand, will try and have a panel with not all commissioners, but across the different parts of the commission, including, I think, WHO Europe's invited, and maybe some member states. Because you're absolutely right. I think this is where we need to connect health is in all, should be in all policies. I think we concluded that.
So we are heading towards a very complex society, which is we are living in all the time. So now we're going to understand it and make it work together. Okay, Christoph Stoller, he's the EGA Executive Member, Senior Vice President, Generics and Commercial Operation, Teva Europe at Teva Pharmaceuticals. We haven't seen you before at the conference, that's why I introduce you the better. What is, do you have a different view than the guy next to you, to the right side of you, or what is the commitment? What do you want to do?
So before
if you wish.
Yeah, before I will let you know how we commit to the solution, let me just answer briefly to Peter, because I started my career in pharma in 1999, and in the area of virology, hepatitis C, and HIV. And you know, if I look back, so that's 16 years ago, right? If I now look back, the achievement which has been made there, it's amazing. I think it's fantastic. You know, at that time for hepatitis C, we were giving patients interferon, and nowadays. So the innovation which has happened is huge. That's the first comment I wanted to make regarding that. And the second comment I wanted to make is also, you know, you talked about the business and all the challenges with hepatitis C and the prevalence there, but you know, I think it would be more important to start even before, right? Talking about prevention. What can be done in order to ensure that this hepatitis C doesn't spread in this group, for instance, by giving out syringes for free, yes, and you know, I'm Swiss, so we did that many years ago. I do not know all the other markets. But I think now coming back to the topic, but I think it's really important. So first comment is, you know, we need to have a holistic view, right? That's been mentioned before in the conference, and actually I did attend this morning. So we need to go away from the silos. And if you want to achieve big changes, you know, it will require the cooperation of everybody. Right? It will be the policymakers, it will be the patients, the healthcare providers, it will be the industry, and it will be also the payers. And I think that's really important to note. Now, we heard from Monika about all the challenges. You said the numbers are so terribly bad. Let's change the numbers. No, that doesn't happen. So how can we overcome all of these challenges? And, you know, I think access to medicines is really a human right. That's for me very clear. And I strongly believe that to the promise of a sustainable and high quality and accessible health systems in Europe, it can be achieved. It can be achieved already today with what we have today. And I think our industry, the generics, biosimilars industry, you know, one way of really helping the systems is by increasing the penetration of generics and also of biosimilars. You know, in some member states, the penetration of generics, for instance, is still very low, right? We have market where it's extremely high, and Germany has been mentioned as an example, where we are at 80% today, while we have markets like Italy, where the penetration today is at 20%. And on top of that, in Italy, and you talked about out-of-pocket investment, right? In Italy, the out-of-pocket just in that market is as big as is the generics market overall in that very specific country. So, you know, and here is really a solution which we can do today. We don't have to wait for anything, right? It can happen tomorrow. If you're able to increase that penetration without any compromise in quality, we can get the savings and we can have better health outcomes. And there's a couple of examples, you know, I think what we can say, and then I think we're totally aligned. Today, the pharmaceutical market, the competition is working. First of all, it is working because we see a lot of innovations coming up. That's already a great news. And then, you know, as not yet a patient, but maybe sooner or later I'll be one, you know, I'm very happy to hear about that. And what you can see from today, when you talk about competition, the moment that generics come into the game, we see a drop of cost of 61%. This is based on the latest IMS data which have been presented at the EGA annual conference earlier this month. And we have 35 billion euro savings coming from generics. So, you know, that's great, but I think we can do more in order to make sure that everybody has access to medicines and that we can have enough money available also for the innovation. And then last but not least, when we talk about innovation, we all want innovation, and innovation is really critical, right? But you cannot invent a new chemical entity every day. That will not happen. And I think we also need to be more innovative with what we can do with known molecules. And one area, it has been mentioned earlier on, HIV you mentioned, or you have mentioned respiratory disease. And I think in these areas we can also do a lot with known molecules. And within EGA we have created a new sector group called value-added medicines for that area. And basically value-added medicines are medicines based on known molecules, but which add considerable benefits to the healthcare providers, the patients, and or the payers, right? And the point just is, and again, there a lot can be done, a lot today. But the point is, we really need to go away from a cost focus to an outcomes focus. And that's, again, has been mentioned earlier this morning, but that's really how we need to look at the things. And basically, I think what is also clear, if innovation is not being rewarded, nobody will innovate anymore. And then we are really going to end up in a disaster from the view of all the different stakeholders. So what we also need, we need to ensure the sustainability of the generics and the biosimilars markets, and we need to make sure that for these value-added medicines, like I said before, based on known molecules, but which add considerable benefits or value, that we also have a mechanism, kind of an abbreviated HTA system, where we will make sure that we get rewarded for that. So that was a long answer to a short question, but clearly, again, it's about really the holistic view, making sure all of us on this panel, but also others, that we collaborate, and the solutions are already here today in certain markets where the penetration of generics and biosimilars are low, and that we don't have to wait for anything. We can just go there to the benefit of the patients and the payers and other stakeholders.
Okay. I have a cross in my head of thinking one thing and want to say something else, but I keep it. I will come back to you. Monika.
Yes.
Hello.
Hi.
You were WHO, Susanna, earlier here, Jakob, and when you're Monika and have the view, but you're really European, you have been traveling a lot here, and you have seen all the promises, and you have seen all the possibilities, and you have seen all the obstacles, and you have seen all the failures. So you are so much older than you are in your experience.
I was wondering where you
That
were
was a
going.
That was a good.
Let me translate. It was a Swedish compliment. Just like
That
was a compliment also.
And as a Swedish
I need a
compliment, we
holiday,
always
it's
need an
true, I know.
interpreter. Thank you,
Thank
Richard.
you, Anders. Yeah.
What do you see? Because I'm coming up with the. We are saying a little more of the same, all of us here, and sort of. But I'm thinking of what does it take to make a really change? Where are we heading to be 2030? The only thing we know about 2030 is it's not going to be what we think. But if we still, what do we wish it to be? Can you? I'm very interested to hear your views from your experience. Bank in the back of your head, or in the forehead, where it is.
Anders. Well, I think I'm not disheartened by your comments. I think you're right. I think I haven't been around forever, but I've been around in this discussion for a while, and we are having the same conversations, and it's true. And I think the context is changing, and I think our understanding of the solutions and our understanding of what we need to do is changing. And I'm confident and that we are moving in a direction which is very exciting. And this is I wanted to go back to it a little bit, because I think what Peter said illustrated a very important point, which we have touched on. And when we talk about silos, we touch on this, and I think we need to go in more detail. And that's that the people that we are working with, the patients that we are working with, they don't live in silos. They don't live in silos. The silos that they experience from us, from the health community, are of our creation. And a patient who experiences ill health is also the patient who is experiencing risk of unemployment, who is worried about their children's education that's being affected, who has a parent who is in a care facility, who has stresses and challenges on their life, these are individuals with complexity, and they're living within that complexity, and that's always been there. That's always been there. And I think from the policy perspective, our understanding that we also need to address that complexity of the lives of the individuals that we're talking about in order to achieve greater outcomes within our sector, within what is within our control or within our immediate control. And so I'm heartened by it's a process, and I think as we're going through that process, and the Health 2020 and the work of the member states is reflecting that, we're increasing our understanding of both the challenge, our role in the challenge, and what we need to do to take that forward. So I'm not as optimistic as perhaps our understanding of the context is alarming, and we should be alarmed, and that's why we're here. It's a momentum. It's spurring us to action, and I think that certainly has happened. And we've talked about this again a little bit, but perhaps we need to look at this in more detail. There are financial challenges, but there are also structural challenges in what we're talking about. And those structural challenges are much more within our control. The financial components, we talk about the ministries of economy, we talk about the ministries of finance, we have an opportunity with sustainable development, but these are forces beyond us. But the structural issues that we have within our systems are immediate, and they're issues that we can deal with. And on top of that, of course, our health systems are facing incredible periods at the moment. We're undergoing huge reforms in many countries. The competing pressures that we have from many different directions, again, increases that complexity and the challenge. And I think all of that is culminating into okay, well, what's next? What do we do about this? And the answers that are coming back, and it's reflected in Health 2020, it's reflected in my programme of work within Health 2020, but it's also reflected in what's coming back in the consultations that we're having with member states. So for the last 10 months, but particularly the last half a year, I've been undertaking a number of dialogues with member states about what they think we need to do, what they think we as the WHO need to do to support them to address some of these challenges. And the same topics are coming back, the new partnerships. It's something we know it, and we talk about it. When we say, okay, let's bring the Ministry of Education, let's bring the Ministry of Justice. But can you name me a colleague within the Ministry of Education, or from our education sector or our justice sector? Can you name me someone from the sectors that we're trying to address and bring in? If we don't know who they are, if we haven't started that dialogue, if we haven't approached them, then of course we're shooting in the dark. And I think in terms of partnership, again, partnerships are processes. They're about building trusts. They're about building mechanisms for partnership. And this brings us to the second point which is coming up, which is governance. And I mentioned it several times for the last 2 days. When we're talking about new partnerships, when we're talking about new ways of working, when we're talking about innovation and methods, we need to look at the governance. We need to look at the accountability mechanisms. We need to look at how we're measuring it. We need to look at our outcomes. We need to look at how we're institutionalizing some of these actions. And that's different. And the complexity of the vertical governance has an impact there. If we're talking about the European level, national levels, local levels, it's very different in Finland than it is in Italy. It's very different again in the UK. And that's okay. That complexity is okay. And we need complex solutions to complex challenges. But if we know what they are, then that's one good step forward. So I'm not finished.
No, but I was thinking into what you're saying. I will feed you something. You can drink a sip meanwhile. I attended one of your conferences, the Tallinn Charter in Estonia, 2 years ago now, something like that?
5.
No, the abbot after that was 5 again.
The second one.
Joseph,
okay.
you were there.
7, yes.
Can't be 5.
7, sorry.
10 years very soon.
You're wrong.
7, yeah.
Anyhow, I attended the Tallinn Charter some years ago, and it was interesting in the room because...
The first one was 7. The second one was 2.
Come on. How long would you like to sit here any longer, or can we agree with my interpretation here? Some years ago. I forgot what I'm going to say now, but anyhow, in the room there were representatives for all the countries in Europe, not the European Union, but in Europe.
Absolutely.
And Joseph was a moderator trying to sell the Kaiser's frog, which is, or dress as in the Danish fairy tale. And everyone agreed that everyone agreed that everyone agreed that everyone agreed. And that everyone agreed upon. But no one did anything. No one stood up and said, okay, we agree, let's move.
Yeah.
How?
Which brings me to my next point.
I thought so. So I just wanted to introduce that.
It's leadership, right?
Okay, so they were not in Tallinn. Okay, then.
I'm not so sure that...
They agreed.
We all have a role to play. We all have a role to play. We are the health community in our different spaces from our different places. And if we're talking about it, the rhetoric is there, we need to reach out, we need to meet our friends in our other sectors. But also the action starts within our sector. The health community, we are seeing the outcomes of the challenges that we are facing. What is the leadership role that we need? Not just from our health ministers, not just from our health ministries, but from all parts of the sector, because the sector goes all the way down to the bottom, to the patient. It goes all the way down to the level of implementation where we have immediate feedback on the actions that we're taking. So what does leadership for health mean in the 21st century and the challenges that we're facing? And how do we step up to meet some of that? And then communication, of course. Communication, it was mentioned by Peter, it was mentioned earlier in the last 2 days. It's a new world, not only in terms of the digital revolution, whether it happened or didn't. I don't know if we agreed on that this morning, but we have new media, we have new active individuals who are both participating and passively receiving. How do we address communication in this challenge? It's an exciting discussion. And then finally, we mustn't forget the workforce, because when we are asking parts of our community to take this work forward, it is the individuals within our workforce, within our professions, not only in the jobs that they have today, but also the jobs that we need tomorrow. So I realise that I have raised more questions than I have provided answers at this point.
I put down 3 yes and 2 no here, so...
But these are discussions that are happening everywhere, whether that we're talking about Riga or Berlin or the east of our region. This is a moment where we have an opportunity to act.
I really loved what you said. We are the health community. We are in the room, we are that. So if we doesn't fix this, then we should be replaced. More or less.
I'm not sure I said that. Did I say that?
No, I interpret that. No, I mean that a little, because we have all the tools, we have the understandings, we have Andrzej's money, and
don't treat me like cash cow. Okay?
No, I think about you are European Commission, and we have the young people who are looking ahead. But I'm a little worried about the young people, what they're going to do, because the young people, they are not afraid of authorities as I was and am. They have a different view. They are very global. I think they're still using some papers. But they are afraid of different things that we are afraid of.
Turn to them.
Yeah, but I'm looking at her. And I interpret, yes. Yeah, but I'm not, I can just look at one person at the time.
We can't ask one person to speak on behalf of the youth of Europe.
Don't interrupt me. I'm thinking here. I'm serious. But we also face a challenge. We see that at the center I work in Sweden, called Kosinska Center for Families for Children with Rare Diseases. And that is, we are working 25 years now in a family program. And we see the difference from then and now is that young parents then were very safe in their role as a parent, but was not informed. But the young parents today are extremely informed, but are very unsecure as a parent, in the role as a parent. So we see changes are coming, like it or not. Richard, you wanted to say something?
No, it's along these lines. But first, I just want to say I always pay very close attention to Monika when she speaks, because you tend to be ahead of most of us, in thinking. I think there's a lot of excitement now around data and technology, and I want to make a point on that along your lines. But I think you're absolutely right in that the next big question is going to be skill sets. You know, both use that data and interact with tomorrow's population, which they're going to be different. I was here in Riga a few weeks ago. There was a digital economy conference, and all sorts of sectors. And it's actually very refreshing sometimes to meet. There's nothing wrong with my friends here, but to meet other sectors and to get to hear how the discussion is going. And there was a panel with business people from different businesses talking about digital economy, internet, mobile phone technology, everything. And there was a representative from the British Hospitality Association who spoke. So she was representing restaurants, hotels, caterers, all that tourism business. And she talked about how the internet and everything that comes with it has completely changed their industry. And we would say, oh, yes, we know that. We can say. But think about it from the eyes of a hotel owner or a restaurant owner. She said that they don't define the product anymore. So think about that for a second. They don't control the information. They don't define the product. Of course, if you're a chef, you make your menu, and if the food is good, people will like it. But whether they tweet about it or whether they make a review is another question. And maybe it's a few disgruntled people, who are giving the reviews, and suddenly, they don't have, no one's going to come to get your food. So the ratings by websites and everything has completely changed. They said that she said that the most hotel bookings in the UK, at least, or done from the UK now, are not done through Googling for a location, but it's actually coming in through review sites. And the most important thing when people book a hotel or a restaurant or an airline or something, but particularly hotels, is through the reviews by users, not the information put out by the hotel itself, right? So, well, we may say, yeah, that's nothing new. But this has profoundly changed the entire sector. Huh? Now, when I was listening to her, I was thinking, what about healthcare? And I listened to another person recently, Richard Edelman, who runs the Edelman company. He's a thought leader on measuring trust and measuring what people think. And he said this, that when people start sharing information about their health and their experience with health and products, and he was talking to the pharma industry, you're going to lose control. This is going to be not managed by you. It's not going to be managed by the doctors. We already know that we hear from the healthcare profession that they have doctors, patients that come in and have done all these searches. So we already somehow know that, but it hasn't really happened big time. What happens when an Uber shows up and offers to provide the medical services? I mean, that's completely disruptive. What is Uber? What are they? Are they a broker? Are they acting on behalf of some drivers? When this happens in healthcare, we have some things in the US. You have patients like me, 23andMe, people send in the genetic information. It's just the beginning. It's not the beginning. So these people that can't, my daughters as well, they probably would know how to fill out the tax form. How will they go about this? How their whole relationship to their own wellness, to the healthcare system. This is something that we're just simply not really ready for. We are too a conservative bunch, all of us, I think. And it's about data. It's about data. It's about managing that data, knowing that there are no secrets, everything will be transparent. And then it's about what skill sets do we have? How do we equip our healthcare professionals for the future to actually deal with these patients which are doing what they want on the internet?
Okay. Peter.
I'm not so sure, not convinced that, of course we have new communication, that's true, and everybody uses it, and I use it myself. Just a little example, I was chatting with an HIV positive guy here in the country. He's 25 years old, so we just talk about the young people. And he went yesterday to the pharmacy and wanted to get his 3 months supplies of his ARVs. And he told me I was shocked because I did get it only for 20 days. I mean, that's the reality, You might have all these technical equipments. If you're undocumented migrants, you might, get a whole list of medications you could get and that you would survive, and it would be enlightening for you. But at the end of the day, you won't have it. So that's the reality, and that's the reality here from this country. So I don't know this guy, but I'm going to meet him later, and it will be interesting to talk to him. And in this country, 2 years ago, the onset of treatment was not according to the guidelines. I talk about the HIV treatment. They simply couldn't afford it. And this goes to you. You said, you know, the market and competition is working. My statement is it's not working, and you have to accept that. It's not working, and this needs to be changed.
I think you're right, and both of you are right, because we have it, and that's the complexity, and that is the challenge in the society now. The society is like limping, trying to adjust to the new thing, and I see the changes as well when I've been around for a couple of years in the development in Europe. So I feel more confident where we're heading, but if we don't do it together, and then it will not happen, or it will happen anyhow, but it will take longer time. And what scares me most is that young people or the next generation will stand up and say, okay, if you don't want to play with us where we are, then we get rid, we leave you and we do it ourselves. Because the independence and the strength in the people today, and especially in the global people of today, it's very strong compared to when my parents were young, and 50 years, 60 years ago, or something like that. Okay, we are coming up. Isn't this interesting? Hello. Wakey, wakey. I think this is very interesting, and anyhow, so I'm one of those. I'm thinking we are trying to sum this up, and I would like you, each of you, to give 1 minute, or it's impossible for you, Richard, but maybe we should have 2 minutes. Think 1 minute, or think 30 seconds, and then it will be 2 minutes. How would this conference be in 2020? I skipped the 2030. I don't know which country in Europe is presidency in the spring 2020, but say Iceland or Norway. We say Norway because they're not a member.
Maybe Turkey.
Don't make it complex. Norway is complex enough because they are wealthy. Say we are in Oslo and have the Oslo roadmap in 2020. What is the topic? Who are the players in the room? Is there anyone who's going to be in the room which is not in the room today? Or is the target different?
No. If I may start 1 minute.
Yes.
I think we will not have this meeting like this, most probably, because everything will be virtual this time. I would think media today are already giving this opportunity. I see this already the way I can agree with my colleagues participate in the number of seminars online, you know, so most probably will not meet anymore in the room. A pity, but second, I think we will face the very similar problems, unsolved problems, because I don't think society is able to digest so quickly to the changes, and even the taxi drivers, they will still wait, you know, the front of this hotel. Even Uber is dominating maybe the cyberspace.
Different cab, but still a cab.
And the thirdly, and this last point, I think the innovation in the healthcare sector are always tricky problem, because we, as I used to say, the healthcare sector is the most innovative. We always are happy to take innovation as doctor or as patients, but at the same time we are most conservative, you know. And my answer to this is also that when you ask patients, do you like to be operated by innovative or by conservative surgeon, usually they prefer to be operated by conservative surgeon.
Okay. Richard.
I think we will have, if we meet in person or virtually, I don't know, but we are certainly going to have a lot of different people present. I think we will have, hopefully, if we succeeded on Monika's vision, you know, we were going to have employers, we're going to have people that are responsible for, you know, workplace health, taking part actively and thinking about how do we deal with burnouts, how do we deal with depression, and how do we deal with hard labor at work, you know, with RA patients, how do we diagnose them earlier, and how do we manage that? So hopefully that's going to be the case. We'll certainly have the IT guys, big time. I think, and this is probably not too much of a visionary projection, but as was discussed this morning, I think the sensors and patient-reported outcomes, so automatically recording, you know, your own body, is going to be completely transforming what we are doing. I read an interesting article about the car industry the other day in New York Times, where they described how this is the next new era. They say 10 years from now, people will not choose the car just on the steel or the design or the engine. It's going to be the interaction between the car and the machine and man, for both safety, for, you know, whatever entertainment you should have when you're driving. That's going to be, and that's why they're all scrambling with having OS operating systems in the cars and so on, because that's what that industry's realized, its interface. We're going to have that as well. I think it's going to be us interacting with our devices about our health and wellness. It's going to, and where that takes us in terms of big data and nudging patients for better, you know, looking after themselves for prevention, you know, you can only predict. But I'm actually, at the end of the day, I'm very optimistic about the future. I think that all of this is getting complex, but it's coming together, I think.
Okay. Thank you. Christoph?
It's interesting that you picked Norway as the location, because this is one of the bad examples when I talk about sustainable markets. This is a market.
You're talking about my neighbor.
Yeah, I know. Okay. So that's why I'm hoping that by 2020 we have been able to change that in that very specific market and to create a sustainable market for generics and biosimilars in Norway. Now, it has been mentioned before, I guess we will see that at that conference more healthcare providers, you know, like I mentioned before, it has to be a holistic view, otherwise we will fail big times, right? And so IT is going to be extremely important, but as it has been said this morning, you know, to have, if I hear the number of 120,000 apps, you know, that's actually quite shocking, because, you know, I think sometimes less is better, because sometimes it's just cool to have an app, but we should really think about what is the benefit. What is the benefit for the patient, or what is the benefit for the healthcare provider, and then develop a solution along the patient journey, and not just develop an app because nowadays it's just in and it's...
You mean we have seen a structure?
Exactly, and that by that time we have really good solutions where we have seen clear benefits coming out of that. And I do assume, of course, that we will still have pharma with the products on the podium at that time in 5 years from today.
Okay. Peter.
In 2020, people will be very tired of all these new technologies. PowerPoint will not be allowed at the conference. And in the preparation of the conference, there won't be any telephone online conference taking place. You would meet in real. In 2020, patient organizations would be on a table to the same extent as pharmaceutical industry is here. And I talk not only about patient representatives, I talk about patients themselves, because they have their own voice and they could speak up. I like the idea that it takes...
You mean that patient organization...
Patients.
Yeah.
I'm a person living with HIV, so I can talk on behalf of my own, and I do that, and others could do this as well. And to have them equally on the table, I think it's something very enriching, very, very good. Yeah. So this will be a standard, acceptable, and nobody would challenge that standard in 2020. I like the idea to have it in Norway, because in Norway the authority on prison health is with the Ministry of Health, and not anymore with the Ministry of Justice. So this conference might give us the chance to look into that deeper and to learn from it.
Okay. Monika.
I was reminded in 2020, absolutely, of the saying, the future is here, it's just not yet evenly distributed. And I think that in 2020 and today, we need to make sure that we are not leaving parts of our society behind. The vulnerable, people at risk of poverty, people at risk of exclusion, the prison population, migrants, we know who they are, we have the list. And in moving forward towards equity, towards universal health coverage, we cannot do it without an inclusive approach that covers all parts. And we have to maintain that in mind, because it's very easy to race away. I think we also need to be open to learning from all parts of where innovation is happening. I think we need to make sure that we're listening also to what's happening at local level, to what's happening at different parts of our region, that we're having a heterogeneous discussion, and we can see it from across the member states that this is happening. Action is moving forward, and I take back a challenge for myself that by 2020 we will have a better understanding of what can be systematically applied, and we're working with the Observatory at the moment on some of that. I'm sure we're going to strengthen that as we go forward. So what works, what can be rolled out, what can come up, and how do we take that forward? By 2020, we will understand that more, and how we can support member states to take this forward. And perhaps a plea, perhaps by 2020, so this is the Oslo Declaration, is that right? That's what we're aiming for in this context. We can bring a friend. So not just that we're inviting other sectors to join us, but that we from the health side, in order to qualify for participation, we must bring a friend from another sector. We must have broken through the silos that we are currently struggling against, so that we register in tandem. And we're taking steps already to strengthen our work with our partners in the UN agencies, with UNESCO and others, so that I'm prepared to bring my friend in 2020.
Lovely. That's a challenge. Then I have to get some friend. I think if I try to give a view and try to add what we're saying here and linking into what you say in future is here but not distributed yet, I think that 2020 we will see the globalization. We haven't met the globalization yet in Europe. It's coming slowly. We are working very much in international society. We have been international for years, but the global situation, the migration, the changes of culture, the changes of diseases, the changes of behavior, the changes of everything, I think that migration, that changes, will force us to make the changes necessary to deliver the society we today describe. So I embrace the globalization, because I think we need that extra power and reason to make the changes we know. So I truly believe what you say, future, and I will bring a friend. I like that. So we are all invited to the party in Oslo 2020. I think I have to talk with them.
Get them to be EU members until then, so we have to work on that then.
Okay, I will talk to the king and ask if he can do something about it. Otherwise, he can invite us as a guest, as a friend. Okay. That's all for the conclusion. We are having one more point here, so I haven't got any direction how to deliver that, but that is a reflection on the Riga roadmap is going to be made, but they are done by 4 people, and 2 of us sitting here, and the rest can be dismissed from the stage. And I think we give the panel and the new thing. Thank you very much, and an applause.